Numstar 1. Basic drug information, category, details. Generic name Perindopril. Drug class, angiotensin-converting enzyme ACE inhibitor. Brand names, Coversyl, Acion, Perindo, Coversum, Covance Plus, Perindopril plus Indapamide, Coveram, Perindopril samlodipine. Dosage forms, oral tablets, 2 milligrams, 4 milligrams, 8 milligrams. Active metabolite, perindoprilat, pregnancy category, category D, contraindicated during pregnancy. NASHR 2 definition. Perindopril is a long-acting ACE inhibitor used primarily to manage hypertension, heart failure, and stable coronary artery disease. It reduces cardiovascular morbidity and mortality by relaxing blood vessels, lowering blood pressure, and reducing cardiac workload. It's often prescribed alone or combined with other agents, e.g., indapamide or amlodipine, for enhanced cardiovascular protection. 3. Mechanism of action. 1. ACE inhibition. Perindopril is hydrolyzed in the liver to its active form, perindoprilat, which inhibits the angiotensin-converting enzyme responsible for converting angiotensin 1, angiotensin 2. 2. Vasodilation. Decreased angiotensin 2 levels lead to arterial and venous dilation, lowering systemic vascular resistance. 3. Reduced aldosterone secretion. Lower aldosterone causes reduced sodium and water retention, decreasing blood volume and pressure. 4. Bradykinin potentiation. ACE also degrades bradykinin. Inhibition increases bradykinin levels, promoting vasodilation, but may also cause dry cough and angioedema. 5. Cardioprotective effects. Reduces afterload and preload, improving left ventricular function and preventing cardiac remodeling. 4. Pharmacokinetics. Parameter details. Absorption 65 to 75% after oral administration. Bioavailability, active metabolite 20 to 50%. Time to peak concentration, Tmax, 1 hour, perindopril, 3 to 7 hours, perindoprilat. Protein binding, 20% for perindoprilat. Metabolism, hepatic, perindopril, perindoprilat, active plus inactive metabolites. Half-life, perindopril, by 1 hour, perindoprilat, 30 to 120 hours, terminal phase. Excretion, primarily via urine as perindoprilat. Steady state, achieved after 3 to 5 days of daily dosing. Number 5, therapeutic uses. Essential hypertension, primary indication, heart failure as part of combination therapy, stable coronary artery disease, reduce risk of cardiovascular events, post-myocardial infarction to improve survival, particularly in LV dysfunction, diabetic nephropathy and proteinuria, off-label, kidney protection. Clinical indications, condition, clinical goal, hypertension, lower BP prevents stroke, MI, and kidney damage, heart failure, reduce preload and afterload, improve symptoms and survival. Stable CAD, reduce risk of MI, cardiac death, and stroke. Post-MI or LV dysfunction, prevent remodeling, improve prognosis. Number 7, contraindications, hypersensitivity to perindopril, ACE inhibitors, or any excipients. History of ACE inhibitor-induced angioedema, hereditary or idiopathic angioedema, pregnancy and breastfeeding, severe renal impairment, creatinine clearance 30 milliliters per min, bilateral renal artery stenosis or renal artery stenosis in a solitary kidney, concomitant use with aliskiren in diabetic or renally impaired patients, hypotension or shock. 8. Precautions before taking this medicine. Discuss with your healthcare provider if you have kidney disease or are on dialysis, liver disease, dehydration or electrolyte imbalance, especially sodium or potassium, heart valve disease, aortic stenosis, diabetes, risk of hyperkalemia with ACE inhibitors, are taking potassium supplements, diuretics, or salt substitutes. Pregnancy can cause fetal toxicity, especially in second and third trimesters. Cough or allergic reactions with prior ACE inhibitor use. 9. How to use. Take by mouth once daily, preferably in the morning before meals. Food may slow absorption. Swallow with water. Do not crush or chew tablets. Take it at the same time each day for best effect. Continue even if you feel well. Hypertension is often asymptomatic. 10. Dosing information. Indication, initial dose, maintenance dose, max dose. Hypertension adults, 4 milligrams once daily, 4 to 8 milligrams once daily, 8 milligram day. Heart failure, 2 milligrams once daily, 4 milligrams once daily, 4 milligrams per day. Stable coronary artery disease, 4 milligrams once daily for 2 weeks, increase to 8 milligrams once daily if tolerated. 8 milligrams day. Elderly, 65 years. Start at 2 milligrams once daily, titrate slowly, up to 8 milligrams per day. Renal impairment, mild CRCL 30 to 60 milliliters per min, start 2 milligram per day, moderate severe, CRCL 30 milliliters per min, 2 milligrams every other day. Number 11, misdose, overdose. Misdose, take as soon as you remember. Skip if close to your next scheduled dose. Do not double the dose to catch up. Overdose symptoms, severe hypotension, shock, dizziness, bradycardia, renal failure, electrolyte imbalance. Management, place patient supine, IV normal saline for volume expansion. Monitor vital signs and renal function. Hemodialysis may remove perindopril. Number 12, when to stop or avoid taking. Discontinue and seek immediate medical attention if swelling of the face, lips, tongue, or throat, angioedema, severe dizziness or fainting, hypotension, persistent dry cough affecting quality of life, signs of infection, low WBC count, jaundice or dark urine, hepatotoxicity. Pregnancy occurs, must stop immediately due to fetal toxicity risk. Side effects. How common? 1%. Dry, persistent cough, headache, dizziness, fatigue, hypotension, especially first dose, nausea, vomiting, diarrhea, taste disturbances. Uncommon, rare, rash, itching, urticaria, muscle cramps, hyperkalemia, elevated liver enzymes, angioedema, potentially life-threatening, neutropenia, agranulocytosis, rare. 14. Vital clinical information. Monitoring required. Blood pressure, serum potassium, renal function, BUN, creatinine. Signs of angioedema or allergic reactions. Lifestyle. Avoid alcohol, enhances hypotension. Maintain hydration. Avoid potassium-rich salt substitutes unless approved. Rise slowly from sitting, lying positions to avoid dizziness. Pregnancy warning, causes fetal injury and death, renal failure, skull hypoplasia, hypotension. Stop as soon as pregnancy is detected. Number matter 15. Drug interactions, drug class, interaction effect. Diuretics, thiazide loop, additive hypotensive effect. Potassium-sparing diuretics, spironolactone, amiloride. Hyperkalemia risk, NSAE, ibuproxen, reduce antihypertensive effect, renal toxicity. Lithium toxicity. Other antihypertensives, additive BP lowering, aliskiren, contraindicated in diabetes or renal impairment. Trimethoprim, cotrimoxazole, hyperkalemia risk, heparin, potassium levels, gold injections. Nitritoid reactions, facial flushing, hypotension. Summary table, aspect, perindopril. Summary, type, ACE inhibitor. Mechanism, blocks ACE-ANQ, vasodilation and aldosterone. Half-life 30 to 120 Hz, active metabolite. Main uses, hypertension, CEPH, CAD. Cautions, renal impairment, pregnancy hyperkalemia. Common side effect, dry cough. Serious effect, angioedema. Monitoring, BP, K, renal function. Contraindicated with aliskiren DM, pregnancy. Thank you. Have a nice day.